Welcome to Birthing Beyond 35. I'm your host, Hayley Burns, and each and every week I sit here and basically chat with women who are over 35 about their pregnancy journeys. And this week, it certainly is one for the books. It's packed with a lot of really interesting information, albeit a little bit scary maybe, or a little bit uncomfortable for some people to listen to, but again, really interesting. Kyle joins me on the show to discuss an extremely, I guess, shall we say it was traumatic, an extremely traumatic first birth when she was 32. She delves into the challenging years that followed in her quest to then conceive baby number 2, which she did, and in the end, she ended up having a baby girl 3 days before her 40th birthday. And when I say that Kyle faced challenges, I'm not talking about morning sickness or a bad headache or an achy back. I mean, here is just a snippet, a glossary of sorts of some of the terms that Kyle had to suffer throughout her pregnancies.
It's called symphysis pubis dysfunction. Did a suction when I was hemorrhaging. Found I had retained placenta. Ended up doing a D&C. It's called Asherman's syndrome. I had placenta previa with Emma. And then they determined as it got even closer that it was called a placenta accreta. She's like, I need to know how you feel about a hysterectomy.
I didn't know what half of those were, so I've put each term and its medical description in the show's notes. And when I say you are going to learn a lot today, I mean it. Kyle was so open about the truly testing years she put her body through in order to have her 2 babies. She's one hell of a woman. She's so articulate in the way she speaks, and I could have talked to her for 4 hours, but we made it a solid hour, and I really hope you enjoy today's episode. Joining me now is Kyle from beautiful Connecticut. I'm a little bit biased because you do obviously have that New England fall weather going on right now. How are you?
I'm good, thank you. How are you?
I'm good. I'm in sunny California, which is great, but the leaves aren't as orange.
Yeah, beautiful fall here right now.
Oh, envious of you. So thank you for joining me today. Tell me about your little ones that you have and how you met your partner.
Yeah, so we have 2 kids. We have a little boy, Brady, who's 8 years old, just turned 8. And we have a little girl, Emma, who is 9 months old. Tim and I have a funny story how we met, actually. We were both living in Boston at the time. I had moved there from Connecticut. He had moved there from Maine, and looking to meet somebody new. And we simultaneously joined Match, which I don't even know if people use Match.
I don't know if that's a thing anymore.
I don't think it is. So that just ages me right there. So I
do love, I can hear the Boston, I can hear the New England accent coming through now. I love it.
So we both joined Match kind of on a whim and thinking like, we'll see if something comes of this. And no horror stories from either of our dating experiences on it. And then we were both pleasantly surprised when we met, and we still to this day are like, I can't believe that's actually how we met. Like that actually worked.
I'd say it's how most people meet these days.
Yeah. And now there's like way more options online to meet. But at the time, it was kind of just a few. And we went on a date, met at a restaurant, and have been together ever since.
Was it a sports bar?
It was like an Irish pub
the Boston way.
Bar. Yeah, 100%.
Were you watching a Patriots game or a Red Sox game?
I'm sure we were watching one of the two, and every year after, we went there for our anniversary.
That's so fun.
It's like a little tradition. And then we got married a few years after dating, and pretty much after we got married, we knew right away we both were big family people and wanted children. So very quickly decided to have kids. We knew we weren't going to wait.
So how old were you when you had your first baby?
I was 32. Same with Tim. We're just a few months apart, and we were married October 17th, and our son was born the following October 12th. So within a year, right before our first wedding anniversary, we had him. And I was 32 at the time.
Sorry, was there any trouble conceiving or straight away just happened
No
for you?
trouble conceiving, really. It was just a few months. I want to say maybe even 2 months of trying. It went fairly quick. We didn't really know what to expect. We say we were like blissfully naive, and just started trying right away, pretty much as soon as right after the wedding. And the conceiving part was not the challenging part for us. It was after birth that was the challenging part for us.
Oh, we're obviously going to get all into that.
Yes.
So why don't we go? So this is Brady. Brady's your first child. So
this is Brady.
You're pregnant. How was your pregnancy?
Pregnancy was great. I had a few things that I learned about during pregnancy that I hadn't heard of from friends and things like that. I had it's called symphysis pubis dysfunction. And at the end of pregnancy, my third trimester, essentially my body was producing too much relaxin. So my hips were like, my pelvic bone was like separated too much. So your body produces it naturally to have a smoother delivery, but it can produce too much. And so like the joints holding my hips together were like jelly pretty much, and not
very stable.
Not stable. So it was excruciating.
Ouch.
So that was very challenging. I did not anticipate that.
Is there anything they can give you hormonally or anything to help that? Or is it just the way it goes?
It's like a band that they put around your hips. You can do a band and it kind of holds everything in. So like when I was working, I would wear the band and it kind of keeps things more together. But yeah,
like a brace almost, I guess.
Exactly. It was like a brace. But that was very painful. Aside from that, the pregnancy itself was pretty smooth. Really no morning sickness, pretty minimal nausea. Yeah, it was a very smooth, quote unquote, normal pregnancy, I would say.
So tell us about the point where you got to, I guess, delivery.
Things getting challenging. Yeah. So he was just very comfortable and didn't want to budge. So he was due October 3rd. And
so that's 40-week mark, I guess.
Yes, 40 weeks. And ended up being induced October 10th and then didn't come till October 12th. So he was like not budging. And the induction just didn't, I mean, in hindsight, I'm okay. He's okay. So that's all that matters. But it wasn't a smooth delivery at all. He just was not coming out. His heart rate dropped several times, pretty frequently, very close to C-section several times. And we didn't really go into it with a plan. It was like, get our baby out healthy, whatever you need to do.
When you say close to C-section several times, is that them just going, hey, his heart rate's dropping.
Yes.
Be ready because we might be doing this. And then I guess his heart rate would come right and they'd be like, yeah, okay, we're good. Keep trying to do what you're doing.
What it was. Yeah.
Oh, I mean, that's not a head fuck at all.
Yeah, 100%. Yeah. One time they're like handing scrubs to Tim and they're like, you just need to be ready. We're going to head in. And then we'd be like near tears, like, okay, we're going to do this. And they'd be like, oh, look, things are back in control. We'd be like, okay, in hindsight, I don't know, but we both look at it like, I almost wish they just did the C-section because the vaginal birth was pretty traumatic. He wasn't budging. I pushed for 4 hours.
How dilated? Do you remember, if you remember that at all? Were you when they were trying to get you to push?
I don't remember, actually.
That's okay.
I don't remember that part. So I was in labor. Yeah, they induced me on a Saturday morning and he wasn't born until Monday. Yeah, so it was like the Pitocin and they gave me all the things. I got an epidural and he just, contractions, the works, was pushing for 4 hours. And I pretty much everything was like on if you go this much further, we'll need to do a C-section. And then I would just get it done right before that cutoff. So it's like, well, pushing can take 10 minutes or 4 hours. I was at the 4-hour mark and then he still wasn't coming. So they did a suction. And
the vacuum.
Yes.
So tell me about the point, like that conversation where they are like, hey, FYI, we're probably going to have to use a vacuum on your child's head.
100%. And I don't even remember. I feel like at that point I was like so delirious. I hadn't slept in 2 days.
So out of it. You're just like, get this thing out of me.
Get him out. Like, do what we need to do. So they attach a vacuum. I luckily had the epidural. So like I was tired and it was painful, but not in like a direct way because it was like pretty numb. But it was everything was uncomfortable at that point, and they would literally like yanked him out of me. But they said we can only do that for the safety of him and youth up to 3 times. If it doesn't work after time 3, we can't do it anymore.
Oh, wow.
So he came out on time 3.
Gosh, how scary. And I imagine you, even though you got the epidural, you're so tense.
100%.
The opposite of relaxed.
Yep. And it's destroying, which I learned after, your pelvic floor. Like all of those muscles nothing is natural at this point. He's being ripped out of me, pulled out of me.
You need to actually, I did, when I had my own, when I was preparing for pregnancy, I did like Google the vacuum thing, but I'm going to have to look at it again to see this instrument that they use and force on you. I guess they're not forced. Like I get it. Like it's for a health reason, but it is, from my understanding, extremely brutal.
Yeah. It's like semi-barbaric. It's necessary, but he had a huge, like contusion on his scalp. Like it was a humongous like circle bruise, almost like a hemorrhage, like a dome on his head.
Cool
that
thing.
Was terribly bruised. And because of their skin is like so delicate at that point, like tore some of the skin off of his scalp as well. So it was like scabbed over.
Gosh.
Yeah. So aside from that, he was healthy when he came out. I, however, hemorrhaged at that point. Again, I think my body just wasn't, it was almost like he just wasn't ready to come out on his own naturally.
Okay.
And
so you've delivered him. So he's been pulled out. And then how soon after did you did you get to hold him, or is it just like,
so I didn't hold him right away.
We're on here.
They scurried him away. They were checking his head. This is where it got fuzzy for me. I remember looking over at Tim and
just delirious and exhausted and
tired. And that's when I was hemorrhaging and didn't really like realize.
Did you know? I guess you wouldn't know because you were numb.
But I did know like something felt not right. I got super nauseous, which that part is common. I got very nauseous, and I was certainly not unconscious, but I was like going in and out of like being coherent. And so Tim got really nervous at that point. He's like, is the baby okay? Is the baby okay? But like somebody needs to check on her. Is she okay? Because I was like very in and out of like grogginess. And in hindsight, that's because I was losing a lot of blood and was just very like almost confused. Like I was so confused at that point and delirious. And then I remember this part is funny. And I tell every single friend of mine who's pregnant ever since then. Don't know how I didn't know this, but I thought more so the placenta like delivered naturally post baby. And so they're starting to push on my stomach to like push the placenta out. And I was like, what are you doing? And they were like, we're working the placenta out.
What a time to find out.
Yeah. I was like, no. I did the hard part. Like, stop touching me. Like I was so touched out at that point. Like,
so how are you thinking they got it out surgery? Or you just didn't really comprehend or think?
Yeah, I thought
it strains itself or something
came out and it was attached to the umbilical cord. It just like naturally came out.
Yeah.
Like I thought it was like a very pretty like smooth process. I didn't realize they really had to like knead your stomach to move it out.
Well, that's not a stupid thought. It's just, I think that's okay to think that.
I was like blissfully unaware that was a thing. So after that, anytime a friend was pregnant, I was like, just so you know, because I was so.
And are your friends like, I can't know this. I did the courses.
I'm not going to tell you any of the scary stuff, but just so you know, they're going to push on your stomach. So they were pushing. And I was like, no, I need to be done. I'm done. Like, I thought we're done here. I did the hard part. The baby's here. Like, stop. Then at that point, they brought him over to me. And this part was challenging. Even now, when I think about it, it's hard because I remember almost feeling like, I don't know the best word, but like not ready to hold him because I was so physically.
You hadn't decompressed from the trauma.
I was like compartmentalizing the trauma. And I was so sick feeling and tired and like.
You're just like, this isn't how I want to connect with him right now.
It's exactly what it was. So like you picture this like blissful bonding, lay on my chest and I'll breathe you smell the new baby smell. And like, I was like waiting for somebody almost to like pick him up off of me because I was so uncomfortable. And like, I'm going to drop
he a big baby?
No, he was 7 pounds, 8 ounces. So like fairly average.
Yeah.
They put him on me and they're wheeling me to like the, next room. And I'm like, am I okay to even hold him? Like, am I going to drop him? Like I was so...
Didn't feel confident or comfortable.
No, it was just not how I pictured it. We stayed in the hospital for a few days. I had several blood transfusions.
Okay, so so at what point have they told you? They're like, oh, FY, you're hemorrhaging and we need to do some stuff?
Once I went back, if I remember, we went back into the room and they were like, you hemorrhaged, you lost a lot of blood. We need to move forward with blood transfusions. I was like, do what you need to do. Like, I felt so sick and terrible at that point. Like, but I had nothing to compare it to.
Yeah.
And it was like, I knew it wasn't good, but I didn't know like quite how traumatic it was, just because things kept like, I was like, oh, this is childbirth. And I knew it's not going to be comfortable or, but it was.
Had you known anyone that had hemorrhaged, or had you heard much about hemorrhaging?
Nope. So a lot of that was new. A lot of that was, we were figuring it out as we went.
Yeah.
So didn't know anybody who had hemorrhaged. So I think I had 2 or 3 rounds of blood transfusions. Finally getting into the groove. I was like very, like the maternal instinct after that kicked in right away. I feel like once I felt more like myself, I was like totally ready to bond with him. Yeah. And then it like clicked, but it was like that first, like, just like half a day, I was like, I can't even, like, I'm not myself. Like, I'm like a shell of myself right now.
Yeah.
And then it
doesn't help that, like, you feel like, you see the movies and you see all the things and your images, everything's be blissful and there's music playing and the stars are aligned and
I was like, I'm barely conscious and I'm like really struggling to like pull myself together right now. Like, I'm not capable of taking care of a human right now. So was in the hospital for a while, had a 3rd-degree tear as well because of the vacuum. So that was pretty painful.
Did you know that straight away, like when the epidural was wearing off, or someone kind of pointed it out?
Yeah, they were like, you have like, we're going to be doing quite a few stitches. So that was, I knew that right away. And then I was like, what's the range of like 3rd degree? Like, what does it go up to? They're like 4. I'm like, oh, okay. So we're on the, Then we came home from the hospital. Aside from being like feeling beat up and not great, it was still like we were kind of like, okay, this is the new normal. We're good. And then several days later, I want to say 5 days later, I got a fever at home. Had to go back into the hospital and they found I had retained placenta.
Gosh, so what were the thoughts going through your head when you first kind of got that fever? Did you think it was like, maybe I've got mastitis? Like,
I think at that point I was crying. I was like, I don't want to.
What made you go back to the hospital?
They had, ironically, like the day before I had, I think they sent me with an at-home nurse that was coming occasionally because of my stitches in the 3rd degree and the tear. And so she had said, like, keep an eye on a fever, keep an eye on this. So as soon as I got the fever, I just was like, I don't want to go back in. Like I definitely had post-traumatic stress without a doubt, 100%. Took me a while. I didn't know that's what it was at the time, but talking to doctors after and stuff, like 100% had that. I was like shaking going back in. Like it was like traumatic and I hadn't processed it yet.
And it had only been 5 days. You're like, oh my God, I'm here again.
And I'm here again. And this was the tricky part. I went back in. They said, you have retained placenta. And so
they do like an ultrasound, I assume?
Yes.
I'm so
they did an ultrasound and they said, we see retained placenta. We think we're going to have to remove that. They said, we're going to do a vaginal ultrasound. And I burst into tears.
Don't touch me.
And that's literally, I said, is there any way you can determine this without that? Like, please, I beg you not to go back in that area. Like, I can't, you'll have to just sedate me. Like, there's no way. And they were like, they like talked to their doctors and ultimately they were like, I was like, do you know, like, will that change your decision? Like a vaginal, will that confirm or deny? And they were like, we know it's retained placenta. That's just going to like double down. And now they're like, so to be fair, we don't need that. Like we're confident in moving forward. Like, I was like, thank you so much. Great. So they ended up doing a DNC remove the retained placenta. They did a spinal for that.
Sorry, just for our listeners, what does D&C mean again?
Good.
I know this. I'm annoyed.
I'm going to look this up, actually.
Yeah. Thank you. You're my producer.
Because
I know I've heard the term.
I think the C is cauterized surgical procedure in which the cervix is opened and a thin instrument is inserted into the uterus.
Gotcha.
The instrument is used to remove tissue.
Okay.
And so essentially cauterize it. Yeah. Okay. So they're removing any tissue. I did a spinal for that. I was like, I do not want to feel a thing. Like,
yeah,
I don't want to feel a single thing you're doing.
And yeah, it's just kind of like, this is your fault. Like, is that how you kind of felt? Like, it's like, if you did your job properly, I would have got to be here.
Defeated because I still had that, I think, vision of like, this is not what this is supposed to look like. I thought, like, I was picturing this, happy moment of being home with my baby finally and bonding, and I was breastfeeding, and then we were back in. And then it was again, okay, so you have, we'll keep you post-surgery. Your spinal will wear off within 4 hours. You'll be able to go home at night. So 4 hours comes by, just starting to like feel my legs again. They say, stand up. I stood up and I turned white as a ghost. My blood pressure dropped like crazy. And they were like, you need to lay back down. They did some more testing. They were like, you still have a fever. Your heart rate isn't good. Like you're like all of these red flags. They're like, we need to keep you continue to keep you for 48 hours for more monitoring. So
where's baby at this point? Where's Brady?
So at home with grandparents or with Tim? With us. It was me, Tim, and my parents thinking like they're an extra set of hands. This will be a few hours. We'll be ready to go home. And that point I broke. I literally broke.
Oh, I bet.
I remember like screaming, crying. I'm not that type of person. I'm like fairly level-headed. It was like mama bear, I don't even know what trauma. I was screaming and crying and I was like, I can't be a mother to my baby right now. Like, I don't know how to do this if I'm not available to him. And like, I need to go home. Like, I need to be a mother. And now I have to stay here again. And so it was figuring out how to nurse him, while somebody was handing me to him.
And the spare moments of energy that you have to try and even fathom doing that.
Yeah.
How was that? Side note, like the breastfeeding?
Breastfeeding with him was actually great. He was a champ from the get-go.
Awesome.
He was... Aside
Can you
from
imagine if he wasn't? My God.
Oh my gosh. I know. Luckily, I mean, we didn't really have problems with that. He just latched right away. It was uncomfortable in the beginning, like as it should be. I ended up nursing him for a year. He was really good. We had a successful breastfeeding journey.
So you're in the hospital. You're all, they're keeping you in.
Yeah, I'm pretty sure they like red flagged me for like postpartum depression because at that point I was like hysterically crying, like yelling at the nurse, like, I can't do this. The next day,
that's okay. My God.
The nurse comes in, like tippy-toeing in, like, are you okay?
Can you yell at me again?
It literally, and I remember being like, I'm okay. Like, this is just really hard. Like my level-headedness kicked in. Like, this is just like not what I thought. And like to this day, I want to write a thank you note to one of the doctors. I couldn't tell you who was in the room during my delivery. I have no idea who delivered Brady. No idea. It was not my doctor. I saw 3 rotations of nurses. No clue who's in the room, but I do remember this one particular doctor. Her name was Kristen. And she came to me after when I was readmitted. And so that's like a week now later. And she finds me. She sees my name on the paperwork. And she's like, I just wanted to come back up into the room and say hi to you. And I was like, oh my God, a familiar face. Like, thank you for checking in with me. And she said, I just wanted to come in and let you know that 1% of the mothers I have seen could have done what you just did. And it was awesome. Like such a, that's all I need. It was like a validation of like, yeah, that was really hard.
Yeah.
Because at that point I was like, is this normal? Is this hard? Am I being a baby? Like, is this, and it was like such a relief to be like, no, that was really, really not normal and really hard. Yeah. And like, let me validate the fact that this is like pretty challenging. She goes, this is like a 1% that could handle what you just did. And I was like, thank you. And to this day, I'm like, I need to write her and be like, I forever remember that conversation because
You should. And we'll send her this excerpt as well.
yeah, it
Yeah.
was, everybody else was just doing their job and doing it well, but it was, going through the motions. And she very much, I was not her patient at that point. She had no ties to me. She was not my doctor, and found me, sat in the room with me for a half an hour and just talked.
So nice.
Yeah. It was just lovely, took her break time to just be like, how are you doing? That was really traumatic. And I was like, thank you. Yes, it was.
That's a lot. Okay. So at what point were you cleared to go home?
So we went home 2 days later, and things were good.
Okay.
And I say good.
Yes, with a asterisk.
Yes, things were good. I avoided the doctors like the plague. I was like, never again, unless something is terribly wrong. Nobody's going near that.
Sorry, let me just backtrack. So you've given birth to Brady so you're 32, correct?
Yep.
In your head, in your timeline, were you thinking, I'm going to need a few years to even consider getting pregnant again? Or did you have a bit of a plan in your head of what you guys wanted to do?
When we got married, we had always said we wanted 3 kids. Mm-hmm. During the 4 hours of labor, Tim was joking and said, I think this is going to end up being an only child, isn't he? Yeah. Because at that point we were like, whoa. And I said, and I remember in the midst of the pain, I said, no, we need at least 2. We need at least 2, not an only child, at least 2. So after he was born, I definitely had post-traumatic stress, was like that. I was like, I'm not going to a doctor. We are not trying to conceive for a very long time. I was super resistant to doing that again.
Yeah. Did you ever think, look, I'm fine to have a baby again if it's C-section, so I don't have to deal with all that trauma?
Yep. And I kept being like, should we have had just a C-section? Even though it wasn't our decision, we never told them no to a C-section. It was always
that's hindsight.
Was this how it was supposed to go? I don't know. Would that have made it better or worse? We don't know.
Can't think like that.
Yeah. It was out of our hands. And in the end, he was a healthy baby, and that's really all we needed. Yeah. He got out. He was healthy. I didn't end up getting my period for 3 years.
Holy hell. Wow.
So
what's the medical reason behind that?
So essentially I had, from the DNC and the trauma from the birth, I had so much scar tissue in my uterus that it had blocked it, essentially. The technical term it's called Asherman's syndrome.
Okay.
So Asherman's syndrome, I went in and finally, literally after 3 years, I was like, I think I'm going to have to go to the doctor, aren't I?
So you waited 3 years?
Yeah.
Wow.
Yep. I literally waited 3 years and was like, well, I'm going to have to go to a gynecologist.
Okay, so you're 35 now, I guess, at this point, and you're
figure this out and why I don't have a period. This is normal, and I'm going to have to do this. And I went into the appointment. I had a new gynecologist at that point, and I immediately, it was all right, lay on the table. And I am shaking, full blown anxiety attack, and was shaking and was like, I think I have
the thought of someone touching you.
Yeah. And it was the instruments came out, and I was like, she was absolutely wonderful. And she was like, look, I had a pretty traumatic, she never disclosed what it was, but she said, that's the reason I became a gynecologist. I had a very traumatic experience with a doctor, and I swore that would never happen to one of my patients or anybody I know ever again. And I became a doctor. Wow. And so I was the luck of the draw for finding this particular doctor. So she couldn't have been more wonderful, and was just very patient and understanding. And essentially they did a thing called a sonohystogram. I have all the technical terms for
No, that's good. I'll be using them all at the end.
Sorry to dump. I bet you weren't expecting this.
So this is what it's about. It's learning.
Good.
How do we learn without these conversations?
And Tim said that. My husband has said that forever. He said, I wish there was a platform for you to talk about this, or people to talk about this, because nobody knows, and it's not talked about, and it's more common than people think, but nobody has a place to talk about it. And so they live with it, silently suffering. Because
did you ever go on blogs or anything, or just what to expect, those kind of websites, and be FYI? If anyone wants to know about this.
I never disclosed it, but I would read a little bit to see what people's experiences were.
Yeah, that's what I'd do as well. I would never really write anything, but I just want to read.
Kept the horror story, and which is why this kind of pattern continues. When my friends would get pregnant, they knew it, but like if a close acquaintance did, I wouldn't go into details. I'm like, I don't want to scare them.
Yeah.
So so a lot of it is kept secretive for that reason. It's like, well, I'm not going to tell you all the things that went wrong.
Yeah.
So
it's just a sprinkle.
So they did a sonohystogram, which is like they inject a liquid into your uterus to see how much space it fills up. The liquid fills up to see like how open the cavity is. And they did it. And I remember them looking at it, and them calling another doctor in. And she was like, you are stage 4 Asherman's. And I was like, I don't know what that means. And they were like, that's the highest level. Like you have no space. Like you have no space. Like we can't even get the fluid in there. And I was like, oh. And they were like, so that explains why you're not getting a period. And I said, so again, being naive, I said, so what does that mean for like having more kids? And they were like you could tell like the look of like, oh, she's not getting it. They were like, you can't. Like you.
Did they say like
yes,
or did they say you can't, or were they like your options may be very limited?
Correct. They said it would require additional surgery. And again, that's like, what? Well, now we're here again. So I said, well, what if we don't do a surgery? Like, what if we opt out of that? Like, can we still have more kids? And they were like, you won't be able to. You cannot have more kids as is. Like without additional surgery, you would not be able to conceive.
Okay, so what did you do at this point?
So I went into the car, sobbed, and said, we're never going to be able to have kids again. That's the decision. And now it's not up to us. It's up to somebody else. And this feels like we were robbed of that decision. Yeah. And then we decided to do the surgery. And we said, let's just see. Maybe it works, maybe it doesn't, but at least it'll be our decision and not.
Is this a surgery you can be under, or are you just awake but numbed out?
Under for it. So they so again, Brady at this point was 3 or 4. They did a surgery where they remove the scar tissue. They remove all the scar tissue, and it is called a hysteroscopy. So the hysteroscopy goes in, they did it laparoscopically. Sometimes you can do it vaginally and not be put under, but for mine, because there was so much, they did it laparoscopically. They removed the scar tissue. I found a specialist, which was, I'm happy I did. And he found, which never did I know I had endometriosis, but they found endometriosis. And the only way they can find that a lot of times is when they're in there doing a surgery. So they're like, did you know you had endometriosis? I was like, no.
This is just going great.
Yeah, let's just pile it on. So they did a successful surgery. They removed the endometriosis as well. I wake up from surgery. They said, just an FYI, your uterus, because of there was so much scar tissue and endometriosis, had adhered to your bowels. So we removed that, but that's like dangerous. And there's a chance it re-adheres. So I was like, okay, but they didn't seem too concerned. It was just something to note, like a little abnormal. Had a successful surgery. So we're like, okay, so let's recover, and then we'll evaluate, and then we will decide. 4 weeks later, I get appendicitis. So I go back in, have the same laparoscopic surgery. They literally were like, you have like the incisions, like exactly where we need to go. And they said, it was at the same hospital. I said, I really want the team that just did the surgery in there at the time of the surgery. So you can I don't want anything to go wrong with what they just fixed. And so they went in and we said, we noticed it had re-adhered to your bowels.
Wow. So quickly.
Yeah, it was too risky to remove, so we left it alone. And you can just exist that way. It's fine. It moves with your body. So it's like, okay. And then we froze. We literally froze. We had thought this is going to be a really long process. There's no way we're in the clear. And the doctor called us. They did another sonohystogram to see how the scar tissue was. And they said, you guys can technically start trying if you want to start trying. And we were both like, wait, what?
Mm-hmm.
Like we had so in our head at that point been told,
written everything off.
You can't conceive the way you are. It will require several surgeries. Like that. At that point, we just were like, this is never going to happen, but like, let's get my body healthy.
Yeah, exactly. I have two questions. Oh, sorry, you go. No, so my first question I'm thinking is, are you producing eggs? No. Are you producing eggs?
I think so,
not
yes.
bleeding. Okay,
just
so was
bleeding.
there... Okay, so did they mention like, oh, you could maybe try IVF?
They didn't think we needed any of it because they said we could conceive naturally. At that point, post-surgery, it was, we removed enough scar tissue. Things look healthy enough. Your uterus is in good shape. Now that the scar tissue is gone, you can conceive.
How long did they expect you to start bleeding again? Like, was there like a, hey, if you don't have your period within 6 months, come back and see us, or
not even? There was pretty quickly. I don't remember exactly what, but I had to take some sort of like a hormone pill. I can't remember the details of it, but the doctor was wonderful, and he was like, "You're gonna call me and text me like once a week until like so." It was very immediate. There was like a pretty clear. You have the surgery. You take these hormones. You start. This happens to your body. Couldn't even explain it now if I tried, and my period started pretty quickly, like within the month.
Okay. How old are you now at this point?
So
after all of that.
Yeah, 36.
Okay. Yeah. So 36 now. You
So Brady's like,
how are you? Yeah. So how are you feeling at this point? Being like, oh, all these years that I kind of feel like I may have wasted.
Yeah.
Is that how you're feeling, or were you feeling good?
We froze. Like, I don't know how else to explain it. We like froze. We were like, wait a second. So now we waited 4 years. Do we want our kids this far apart? Let's just wait a little bit more. We'll think about it. And we kind of kept waiting because we were like panicking. And
I assume your siblings, you're all quite close in age.
Yes. So my siblings, I have an older brother, younger brother, very close with them. We're all pretty close in age. My husband has younger brothers who are 10 years younger than him. They're not extremely close. And so he had like a different perspective of, well, once they get too far in age, they're not going to be close. And I said, well, that's not always the case. And he kept being like, well, we're not super close. Like, so he was, the further away we got, I think the more apprehensive he was getting.
Understandable from his experience. I get that.
So we kind of kept being like, next month we'll think about it. Next month we'll talk about it if we really want to start trying. And we kept dragging our feet at that point. We didn't know.
Were you just like, I'm ovulating, but I'm not going to mention it right now?
We knew, like it was an open
like,
book.
Elephant in the room kind of thing.
Book. We just didn't. We never were like trying. We just were not trying to get pregnant. Yeah. If it had happened, fine, but we certainly were not tracking anything. We were avoiding it, if anything.
Mm-hmm. Yeah.
Then kind of COVID happened too. And it was like our world just like in other ways halted. It was just like not at the forefront. And at that point I was healthy. We were good.
You're just thankful just to have Brady at that point. You know, everyone's just very thankful for what they had.
Maybe if we add another, it's going to mess things up. What if there's complications? And we kept going like, well, what if we get pregnant and what happens with Brady happens again? We have to like really, that was like a 5-year process. Like, what if that happens again? So we kept doing the what if. Yeah. To the point where we weren't doing anything because we were so fearful of that kind of long journey happening again. Mm-hmm. And then essentially, fast forward to our daughter, we were 39. I think I'm 40 now. We are 39. We are 38 and 39. And we kept saying, if we decide to have a kid, we were 38. Now I'm thinking we were 38. If we decide to have a kid, our mental cutoff is going to be 40.
Mm-hmm. Okay. What do you mean by mental cutoff? That you think that it will be, you're mentally thinking it's going to be too hard if we're older parents?
At that point, it was our kids are going to be too far apart. In age, so let's just be happy with what we have and move on. And it was like, there was real no correlation to the age of 40 as opposed to like giving ourselves we're going to be happy with our decision and not question it anymore. Because at that point we had been so back and forth. Do we, don't we, that we were talking to a friend who had adopted. We were like, do we go down the adoption path in order to avoid having to go through that type of pregnancy again? So we started exploring other options. Financially, we couldn't do adoption. And then we knew we didn't want to do IVF. I don't even know if there was a reason why. I know it's expensive too, but it was,
just not the path for you.
Yep. It wasn't, because it wasn't even that we couldn't conceive. It was, do we want to try to conceive? So, we were like, that's not a path we can go on. Let's just, so give ourselves like a deadline. That's when we need to make a decision, because we're still like teetering, and that can go on for years. And we just need to know when to stop and make a decision. So we said, let's just give it a try. Let's do it. I kept thinking ahead and thinking at Christmas morning, I remember opening presents with brothers, and I want that for Brady, whether it's 5 years apart, 5 or 10 years apart. Something about that, resonated with me, and I was like, let's do it.
I'm an only child, so I opened my present with my cat, with my cat and my dog. That was my life. So that's all I know.
Oh, do you remember that feeling different, or that was just all you knew? I don't,
just because it's all I knew. That's all the presents were for me. So that was a positive, but it's all I knew. So it's funny because I'm like my daughter Cooper. I'm like, I know she'll be fine, but at the same time, I knew I had to play Monopoly with my cat and move the pieces for my cat, because I didn't have anyone. So,
and that's all you knew. That's the normal.
Yeah. Yep. Okay, so you're 38, and
we just said, let's try. Let's just see, and that way, in 5 years, I don't want to wait 10 years and say well, we should have, and we didn't.
Exactly.
Let's just do it now, or we're not, because there's only so long we can do this.
To try and fail.
Exactly. And then we know we tried and it didn't work, and we're okay with where things are. And if we just have Brady, we're very happy with that also. Yeah. So we tried, we got pregnant within 2 months. It was we were both shocked, because as soon as we actively were tracking our ovulation, we got pregnant very quickly.
Awesome.
Positive pregnancy tests. And then 2 weeks later, miscarried. So they had, I believe it's technically called a chemical miscarriage, where it was very early on, very, very. And they, our doctors even said, decades ago, people wouldn't even know it was a miscarriage, because they almost just assumed your period was a little late.
Yeah, because they never,
so quick. Yeah, they made
it because you could test so quickly that you even know. Yeah. So how did you cope mentally with that? Were you like, okay, this is the universe telling us no, or were you like, let's keep trying?
Actually, it was as soon as we found out we were pregnant, we panicked. We were like, oh my God, it's happening.
It worked.
It worked. Holy shit, it worked.
Yeah.
Is this the right, we almost panicked, that happened too quick. And now, are we disrupting Brady's life? Yeah. But then when we found out we weren't, we were devastated. Yeah. And it was that
was your answer.
Yeah. It was oh, okay. We really did want that then. And
I guess you were so ecstatic that I can get, my body works. That would have been a big relief.
That's because we at that point were this, we're just gambling. We have no idea if this is going to work. So the fact that it did was shocking almost.
That's what I've kind of said too. Sorry to interrupt, but I have a friend, and she got pregnant, and she was so worried about miscarrying. And I was even if God forbid, you do, you can get pregnant. There's, yes, awful things happen, but your body is capable of getting pregnant, and that's an amazing positive.
Absolutely. And especially since, a couple years before that, the lady, in a not so subtle way, was you can't, it cannot happen for you the way your body is right now. And I remember that being feeling so
I have to
harsh.
ask, is she an older obstetrician? Or I just, sometimes I think the older generation, not that we're young, but they've just been doing the same thing for 30 years. It's all they know. And they just spit out,
She wasn't super young, but I had interacted with, she wasn't super old. I would say she was probably mid 50s. Like she wasn't, but I remember she was very blunt.
Yeah, how rude.
Yes. And she, like no sugar coating. And I remember being like so taken aback by like how definitive she was saying it. And another time I had met with her when like a follow-up for something and me saying, I'm uncertain if we're going to or not. I'm not sure. Our son is this old. I'm not sure how I feel if we do try again. And I remember she looked at me and she goes, well, I think that's your answer right there. You don't sound very interested in it.
There's always one that's like that.
I was so offended by it. I'm like, well, that's not what I'm saying, but that's interesting. And again, that was like another, oh no, I can tell I want it because I was bothered by the fact that she thought I didn't.
The gut will always tell you.
Yes, exactly. So we decided at that point, let's try again. Let's just see, because now we had that like, oh wait, things are working. We didn't think they could. And we had to wait for my body to heal. I think I can't remember how long, a period of time before you can start trying again. I think it was 3 months, if I remember correctly. And we got pregnant the first month we tried, like right away. And that is Emma.
Okay, well, I know that's not how it will happen. I know you don't just get pregnant and then Emma came out. So walk us through.
So Emma's was right away a very different pregnancy. I was very nervous.
You're 39 now?
39, yep. 39, very nervous. Not about my age, to be honest. We kind of were okay with being considered a geriatric pregnancy. Some of our friends have older kids now at this point, and I remember thinking like, we'll be in the older side when our kids are in high school for sure. But we were still, we still had one of my best friends just had a baby also. So it still felt in the realm of like not being, it wasn't unrealistic.
Risky. It didn't feel risky, I guess, to you. You felt good about your health.
Yes, I felt good. I was nervous about having similar experiences to Brady's. But I was okay with my age, aside from just being aware it could offer some additional complications. So different pregnancy in terms of I was very nauseous the first several months, like very nauseous. I was so sick and felt very different. And I remember thinking like, this is a girl. This has to be a girl. This is not how I felt with Brady. We found out it was a girl early on. We did all the genetic testing and whatnot. And we were like very relieved when that came back in the clear. And I think that was, we were kind of holding our breath a little bit up into that point.
Of course.
And then once all that was in the clear, it's interesting because I say it was a smooth delivery. It wasn't, but compared to Brady's, it actually was. But I had placenta previa with Emma. So pretty early on, they noticed that. They said that can change, that can move. This isn't uncommon. This can happen a lot. And your placenta will move over a course of your pregnancy. Essentially, it was blocking the birth canal. So at 20 weeks, they did another ultrasound. They're like, your placenta is fully covering your birth canal. And like, it may not move. It's not looking like it's going to.
How was your mind at this point? Yeah.
Here we go again. Like there's more.
It's hard not to go there when you've had such a traumatic first experience to not think, oh my God, it's all going to happen again.
It's all going to happen again.
Okay, so straight away were they like, okay, you should prepare for a C-section?
Yeah, pretty early on, they were like, if it's this, we need to prepare for a C-section. My biggest thing at that point, I was very aware. I kept saying to them, I know too much now. I know too much. And like, that's the only way I could say it. Like before I really was like blissfully unaware until I had him, and then everything
you just walked on into the doctors and you do what they tell you to do, and but now you're like, oh my God, this can go wrong, this can go wrong, this can go wrong.
100%. It was like I had too many. I was so aware of like all these things that could go wrong, and so I was just like, okay, like just tell me what we need to do to get the baby out healthy. And as the pregnancy continued, they determined placenta wasn't going anywhere, staying put. They were really good, though, I will say, about like looking into my history and understanding the complications with Brady. So they were like, yeah, you have a lot of like scar tissue can lead to this. So there was a little bit of like, oh man, like some of that past birth trauma is still resurfacing as a complication now because of, it's still rippling into my current life. It's still causing problems. So like feeling resentful sometimes of that. And then they determined as it got even closer that it was called a placenta accreta. All these medical terms.
That's what I haven't heard.
Oh, okay. So a placenta accreta means you have placenta previa and your placenta starts to adhere to your uterus.
Okay. Your body loves adhering to things.
Oh, yes. So apparently scar tissue is how my body reacts. So it was adhering to that, to my uterus. And they were, if that happens, it is a non-negotiable C-section very early because you cannot go into natural labor. Cannot. It is extremely dangerous. They were like, that's when I started getting worried. They're like, it is incredibly dangerous for you and the baby. Because
were you kind of a little bit were you kind of like relieved that you were like bluntly told like we're doing a C-section? Like, you didn't have to make a choice. Yeah.
I was like, good, tell me what I need to do. Like, whereas Brady's, it felt very chaotic and unplanned and figuring it out as we went, where I was like almost happy to have a plan, as scary as the plan was. It was like I wanted it to be non-negotiable. I wanted to be like, this is what we were doing. This is when we are doing it. Like they had a team of specialists come in. They have a
So let me backtrack. So how many weeks are you at this point? What have they said?
Like 25 weeks, I want to say, where they were like, we are 100% moving forward with a C-section. And it was around 30 weeks that they determined that it was placenta accreta and that I would have to have a C-section at 34 weeks.
Oh, wow. 34. Wow. Huh. Wow. I had no idea that's so early.
Yeah. So once it was determined,
they're like, we just cannot risk.
You cannot risk going into natural labor.
Wow.
Because essentially your placenta is A, blocking the birth canal, and B, it's attached to your uterus that you will bleed out.
So how are you both feeling like, oh my gosh, we're going to have a premature baby?
It was nerve-wracking, but I kept saying to the specialist, so they had a lot of specialists involved. They have one called, it's a gynecological oncologist, which sounds very scary, but essentially it's an oncologist who specializes in that area for things like cervical cancer, ovarian cancer, and has to perform a lot of hysterectomies. So they like specialize in hysterectomies and complicated situations like this. So I had my general doctor, gynecological oncologist, and they were really on it. And that made me feel good. Like it felt like, again, like a chaotic, like a scary plan, but it still felt very in control. Yeah. I kept saying like, it's the most controlled thing that I've done because these are all the things that could go wrong, but we have a plan. Yeah. So we were okay. I kept saying to the doctor, she's like, I need to know how you feel about a hysterectomy. And I said, we're done having kids after this. We were like, at this point, we felt lucky to be able to have a second.
So you're 34 weeks, you're now in the hospital. Everyone's getting you prepped.
And they said it will definitely be a hysterectomy. Are you okay with that?
Had you known up until that point that could be a possibility? Or was this the first conversation?
No, they had mentioned it probably at like 25 weeks and on as a maybe. And then once they determined it was accreta, like it had attached, they said it will be. And they had several people review that. They were like, it has to be, given your risk of hemorrhaging and additional complications. Like this is the safest way to do this without potential problems. Like it actually is the least problematic way.
Yeah.
So
how did that make you feel mentally, I guess?
I was okay with it, to be honest. I learned a lot through it. So you can still, you don't go into menopause if you keep your ovaries.
Okay.
So they kept my ovaries, and then they removed my fallopian tubes, uterus, and cervix. And that I also learned you can remove like different portions of that. Like you can just do the uterus and the fallopian tubes. You can also do the cervix like it comes, but that was like the best case scenario given where it was adhered to, my scar tissue, all of the above.
Okay, so you've prepped for this C-section. So you've had the spinal tap epidural.
Yeah, they went in. At this point, they had said, Tim will likely be able to be in there for the C-section as soon as they put you under. He has to be out of the room because you're in a general operating floor, not maternity. Yep. And they also had a colorectal doctor in because they were nervous about the bowels being attached to the uterus. So if you're removing the uterus, they were like, the scariest part was I could have woken up with lots of different variables. Yeah. So they said, you may wake up with a bag. Like if we puncture your bowels during this, like this is another.
Most people are just thinking, I'm getting ready for my second baby. And you're going to think, I'm having a baby and I'm going to do all of this stuff as well.
Like a major surgery. Wow. And I kept saying, I need you to keep me alive. I need you to keep my baby healthy. Or they kept saying, what's your goal? Like, are you okay with X, Y, and Z? And I said, take out what you need to take out. I need to be a mother to my son already. Like I kept being like, it's different this time. Like I need to be a mother to him. Like, you need to keep me alive. That is my only goal here. Like get my baby out healthy, keep me alive. Do what you need to do otherwise. Cause like I am currently a mother and need to be a mother for my son at home. Like that was my biggest fear more than anything else this time around. It was like, this isn't just about me and Tim anymore. This is like, I need to be a mother when I get home and be able to take care of him. And like adding a baby to the family is supposed to be like a good thing, not a complication, Once we got into the surgery, they said, change of plans. Anesthesiologist says the safest way to do this is for you to be under for the entire thing, fully under, because of risks and blah, blah, blah. That was hard because that was the only like very last minute game plans.
And you're like, oh, goodbye, Tim. You've got to quickly do all of that. I'm
so
prepared.
Hard for Tim because he couldn't see the baby. Hard for me because
and he's worrying about this surgery.
Yeah. And then as textbook as it could have gone from that point on, it did really. And like woke up. I literally woke up, felt around my stomach to see if I had a bag. I did not. I was like, okay. So we're okay. Is the baby okay? Yes, the baby's okay. Tim got to see her in the NICU. She was 5 pounds, 6 ounces. So she was a really healthy weight, actually, considering her age. She was 6 weeks preemie. And did great. The only thing, she had to stay in the NICU for almost 2 weeks to work on her body temperature. She wasn't quite keeping it up on her own, but she was breathing fine. She was nursing. She was taking bottles. She was doing great otherwise.
Good girl.
So that was like a huge relief. And
what was your recovery like? Your recovery time?
It was interesting because as it was a major surgery, I was, uncomfortable in the hospital as you would expect, but it still felt, again, like in a way more controlled than Brady's did, even though Brady's wasn't a major surgery. I could sit more comfortably. I remember being like, oh, I could sit because I didn't have stitches down there. And there wasn't the suction and all of that. So like, it was hard to do the restrictions because that was new. Like you couldn't lift anything more than 10 pounds. So that part was tricky because I was like, oh, I have a son at home. Like I still need to do things for him. I don't know how people do C-sections when they have a toddler to pick up and things like that. Luckily, my son is old enough to be able to help himself and do things as he,
It almost was the way it was meant to be,
100%.
To have Brady grown up enough that he can help and that you didn't have to, you went, he wasn't dependent on you physically.
We say that now and like, you always look back on things and I was like, somehow, never in my wildest dreams would I have thought I would say this, but somehow 7-year age gap ended up being wonderful.
Yeah, absolutely.
And it was like, it just felt like, okay, this was great. I got my time with Brady. We were so concerned about how many years apart they're going to be, and is it too many years apart, and did we make the right decision?
Yeah.
And then when she was here, it was like, oh, this actually feels like quite nice. And
I get it. Like when, toddlers and kids, like 7 years is a lot, but when someone's 35 and someone's 28, that's, that's me doing math. Yeah. That's not that a big a deal.
Yeah. Like being 40, we joked because we had said like 40 was our mental cutoff of like after 40, we just need to be happy where we are. And like, that's where we're going to stop questioning ourselves. And she was supposed to be due in March. And she ended up being born January 24th, 3 days before my 40th birthday.
It's amazing.
So it's just like really ironic how everything happened. We like certainly couldn't have predicted it. And she's doing great. Like, we weren't sure any preemie challenges and whatnot. She's like doing absolutely wonderful. Brady's great. Took him a minute to adjust. Like when we told him we were pregnant, he said, I thought I was going to be an only child for good. Like I didn't think that was an option. But now he loves it. He helped pick her name.
So much fun. I mean, look, I feel like I could talk to you for 3 hours about all this stuff.
Like I just took up your whole time.
I'm good. Hey, you guys are the one on East Coast time right now.
So it's been a journey.
Okay, so, you're finally at home with Emma. I just said Emma with an R at the end. That's my fucked up accent.
You have a great accent.
It's all over the show. I have 3 accents rolled into one. Okay, so sorry. So you guys, a few months on now with Emma at home. How's your mental health at this stage, like with hysterectomy and like, were there any hormonal changes?
It's been pleasantly surprising. That's been the biggest gain, I think, this time around, because we were so fearful of after, given how Brady's was. I didn't have postpartum depression with Brady. I had no problem bonding with him. I wasn't weepy on a day-to-day, but it was definitely like traumatic experience and going into that environment. And this time it didn't feel as scary afterwards. So it was really nice. Like I felt like I was in a better place. I wasn't as fearful. I wasn't petrified to go back to the doctors and talk to them about things. And I feel like we're more tired as we've gotten older.
Yeah.
The nights are a little harder, I will say.
I bet.
But aside from that, honestly,
there's a great end game waiting for you in a few years.
It's it's great. I can't complain, like we have no regrets, and I didn't find it. Neither Tim or I found it abnormally challenging to have a baby at this age. The cards were dealt to us where this is, when we were 32 and we had Brady, if somebody said, when will you have kids again? We wouldn't have anticipated it being this far out, but this is how it happened. And it ended up being great. And maybe we'll be the older family on the soccer fields and stuff like that.
But I get it. I mean, you just turned 40, you're fine. Kyle, you're amazing.
It feels like it worked out the way it should. And
absolutely.
It worked out. But recovery was, as smooth as it could be, given just normal recovery from a surgery.
Yeah. How long did you wear those pads for?
None. So when you have a hysterectomy, you don't bleed.
Oh, what a treat. That's great. It's a bonus.
Such an added bonus. And the fact that I will never get a period again is also an added bonus.
And the menopause stuff is quite nice.
Yeah. So no menopause until normal. So I've learned a lot about the human body through all of this. Yeah.
You're a doctor now, so that's great.
Lots of medical terms.
Start up a clinic.
And no period. So that was like, my little reward at the end of this, I guess.
That was an amazing hour talking to you, Kyle.
I told you I had a lot to share.
No, I'm so glad you did. No, I mean, this is just so encouraging. And so people are going to learn a lot and just, you know what? Like what I'm learning from talking to so many women is don't just take the first thing your doctor tells you. Don't just listen to, you can't have kids. You probably won't be able to. Like,
yep.
It's one person's opinion. Yes, medical professionals, and we listen to them. I get that, but
follow your gut.
Yeah, exactly. Follow your gut and do what's right for you, and you never know what can happen.
You never know. And I'm glad we, ultimately the path that led us wasn't like the easiest to get where we are, but like I said, it ended up being like, wow, this age gap shockingly ended up being like really great.
Yeah.
And never would we have predicted that.
There you go. Life is unpredictable. That's what makes it great.
Thank you. I really appreciate you having me on. I think it's a great platform.